Those better be clean.
Well, let me just show you.
After patient dismissal, return to room. Don heavy-duty gloves and mask. Place instruments in order in the cassette. Close the cassette. Make sure it's securely closed. Wrap the cassette. You are now ready to transport to sterilization. When entering the sterilization room, make sure you enter through the dirty side. Open the washer and pull out the drawer. Place the plug into the washer. Unwrap your cassette and place it into the side rack in the washer. Loose instruments can be placed in the basket. Slide the drawer back into the washer, then shut the washer door. Press the power button to turn the washer on. The tub will fill up with water and heat up. Listen for a click to know that it's ready to begin washing. Listen for the sound to know that the wash cycle is complete. Open the washer door and pull the tray out. Make sure you stand to the side so the steam doesn't fog your goggles. Pull out the cassette and any loose instruments. Place on towel to dry. Dry the cassette thoroughly. Do not open it. Then you will doff purple gloves and don exam gloves to wrap the cassette. The instrument washer needs to be drained at the end of each day. To do this, open the washer door and pull out the washer tray. Remove the plug from the washer. Remove and clean the filter. Place the filter back in. Turn the power off. Press and hold the drain button until you hear a swoosh sound. Leave the washer open to dry at the end of the day. With exam gloves, be sure all sides are covered and tightly packed. Seal with chemical indicator tape. Try not to use any more than 3 strips. Use the dirty pens to label the cassette package with your initials, date, and locker number. Open the door to the autoclave. Place the wrapped cassette in the autoclave. Make sure the power is turned on. Check the water level located in the tube to the left. It should be in the green level. If water level is low, use the water jug with distilled water to fill it up. If the screen indicates too much water, remove the tube and drain. Select packs. Make sure the door is closed securely and press start. Using appropriate gloves, open the door when the cycle is complete. Dry and ready lights are flashing and unit beeps 5 times. Leave the door cracked until drying cycle ends. Ready light is flashing and unit beeps 5 times. Your instruments are now ready to be removed from the autoclave and stored. Turn off the power at the end of the day. Place the package paper side up. Close the lid and cap. Lower it into the statum until you hear a click. Check the water level. This feature is located on top of the statum. If water level is low, fill with distilled water through the hole on the top. If water needs to be drained, drain through the tube on the bottom. Check the waste bottle for fluid levels. If it has reached the maximum level, remove the lid and discard waste into the sink. Put the lid back on after discarding of waste. Select the correct cycle, the wrap cycle, and press the start button. The sterilizing cycle ends when the reminder tone sounds, the amber light flashes, and the message "Cycle complete" is displayed. Use the Lisa for hand pieces and burrs. Turn on the Lisa. Open the door. Load pack onto tray. Follow the instructions on the screen. If water is needed, add water on top of the Lisa. Listen for the beep or eyeball the amount of water. If wastewater needs to be drained, use the hose located on top of the Lisa. Put it into the gray connector. You will hear a click to know it's in. Water will drain into the bucket. Close the door. Follow the instructions on the screen to select the cycle. Use the spore capsules to test each sterilizer. Label 1 capsule for each sterilizer. Place each into a small pouch. Run each load as normal, adding the appropriate capsule label to the front of the load. When the load has completed its cycle, wait for it to cool for 10 minutes and then crush the middle of the capsule. Put each capsule in the incubator. The green light signals that the incubator is warmed up. You also need to add a capsule that has not been ran through a sterilizer. This is labeled control, and it was crushed before putting into the incubator. The spore test should be read at 24 hours. Yellow means positive, spores were not killed. Purple means negative. Make sure the information is recorded on the log sheets at the end of the session. If a positive result is indicated on a capsule that has been run through one of the sterilizers, tell the department chair as soon as the result has been read. At the end of the 24 hours and after all information has been recorded, capsules may be disposed of in the sharps container. Wow, y'all do a lot to make sure they're clean. I feel a lot better now.